The rehab tool that I will be discussing is the BOSU ball. The BOSU ball is a safe, manageable tool used for progressing balance therapy. It is an exercise ball that is cut in half for half flat surface, and then the other half is a ball. It provides the athlete with a flat but unstable surface to perform exercises which engage various muscle groups. Uses and benefits of the BOSU ball. A benefit of the BOSU ball is that it allows for a safer surface for the patient to work on balance. It also works and helps the athlete build confidence when they are working on proprioception and balance exercises. It is used for implementing proprioception, balance, and strengthening in the rehab process. It can be used for a variety of exercises, including lower extremity, core, and upper extremity, balance and stability training. It can be used for scapular strengthening and stabilization. Some strengths of the BOSU ball would be that it has a wide diameter for the patient to stand on, so that when the patient squats on it, it can help them more effectively perform their squat without compromising their technique. Also, it can be used in various ways, which is nice to help them work on balance. The variety of exercises and challenges presented with this tool makes it a great tool to incorporate in any athlete's rehabilitation and conditioning program. Typically, the BOSU balls cost around $120 to $200, depending on the style and shape and size that you get for the BOSU ball.
So the first group of exercises I will be having the patient demonstrate will be for the core. The first one will be a push-up. So the patient is going to put both their hands onto the BOSU ball and then extend like they would for a regular push-up, and then perform a push-up up and down. For a modification for this, you can either put their hands further out, so spread their hands out, and then do push-ups like that. Or you can have the patients put their knees onto the ground and perform the push-ups that way. The next exercise is going to be a V sit-up. So the patient's going to sit onto the BOSU ball in the middle of it, and then they're going to extend their arms and legs out, and they're going to do a sit-up into a V. If the patient struggles doing this, they can place their hands behind them and then extend their legs out, and then crunch up like a sit-up, just like that. The last exercise for the core with the BOSU ball is going to be Superman. So the patient is going to lay onto the BOSU ball on their stomach. They're going to extend their arms and legs out, and they're going to go up into a Superman position. Now we're going to work on lower extremity exercises with the BOSU ball. The first one I will have the patient demonstrate is going to be a double leg balance on the BOSU ball. The patient is going to step onto the BOSU ball, place their hands on their hips, and then depending on what stage of the rehab process they're on, they can either close their eyes or keep them open. Now we'll have the patient demonstrate a single leg balance onto the BOSU ball. The patient will step onto the BOSU ball with one leg, place the other leg up in the air behind them, and then they will put their hands on their hips, and depending on what stage of the rehab process they are on, they can close their eyes and try to balance on the BOSU ball. The next exercise the patient will demonstrate will be lunges. So the first one will be a forward lunge. So the patient will step onto the BOSU ball in the forward lunge position with their hands on their hips, and then they're going to alternate the legs. An alternation of this will also be a side lunge. So they're going to turn to the side and then lunge onto the ball to the side of them. And they can do that on both legs as well.
The next piece of equipment I will be talking about is going to be the Slideboard. The Slideboard is a versatile tool that can be used for multiple purposes in the strength and conditioning environments. Training with the Slideboard provides a means for low-impact weight-bearing exercises to improve change of direction, balance, agility, while developing muscular strength. Movement on the Slideboard is performed in a closed kinetic chain where the foot or the hand remains in contact with the with the ground throughout the entire exercise. This closed kinetic chain movement creates load on the joints and muscles, which increases joint stability during dynamic movement. A couple uses and benefits about the Slideboard. First, it helps improve strength, balance, coordination, core strength, and proprioception. It also helps strengthen the plantar and dorsal muscles in the foot and the deltoid, anterior talofibular, and calcaneofibular ligaments in the ankles. It also helps activate the core stabilizers for consistent form and balance, and enhances all hip movements. A couple strengths about the Slideboard would be that it helps increase power and speed, it helps improve balance, change of direction, and agility, and it also helps heighten proprioception, and it provides a means for low impact exercises for patients who are in that earlier stage of rehab. Cost for the Slideboard would be approximately about $250.
Setting the Slideboard up is pretty simple. First, you're going to make sure that you set it down with the textured side flat on the ground so that the board doesn't slide around onto the ground. Then, when you're putting in the stoppers, you're going to want to make sure that this part of the stopper is facing into the Slideboard so that the patient is sliding into this edge and not stopping as abruptly as when you put this in first. And the Slideboard has a lock and unlock right here to tell you just how you can unlock it and lock it in the hooks. So picking these hooks is just how you're going to determine the length of the Slideboard that you want to use for your patients. So if you want them to slide longer when they're doing the side-to-side slides, you're just going to put it out here. But if you want it to be a shorter slide, you can put it right there to make the board shorter for them. So putting these in, you're going to make sure that you put it into the wide part first, and then you just lock it back. Okay? So you're going to want to do that on both sides. And then for the patient, they're going to put on these little booties onto their feet so that they can slide back and forth onto the board, or they can put it onto their hands so that they can do the upper extremity exercises onto the board.
So for the upper extremity, the first exercise I'm going to have the patient do is a fly to push up to work on upper extremity strength. So the patient is going to place their hands into the booties on the Slideboard, and then they're going to do a fly. So they're going to reach their hands out and go down and then up in a push-up position. If the patient struggles with doing this, they can place their knees onto the ground and then perform the action again. The next upper extremity workout on the Slideboard is going to be shoulder reaches. The patient is going to place their hands onto the slides, and they're going to reach out on the clock in a 12, 3, 6 motion. And then once they get down to 6, they're going to switch to the other arm and repeat. Next exercise I will have the patient demonstrate is going to be mountain climbers. So the patient will get into a push-up position, and they're going to extend their legs out. With the booties on, they will bring their knees to their chest and alternate legs back and forth rapidly. The next exercise I will have the patient demonstrate is going to be a plank jack. So the patient will get into a plank position, extend their legs out, and then with the booties on, they will do a jumping jack formation with their legs going in and out. The next exercise I will have the patient do is going to be a Slideboard burpee. So the patient is going to jump up in the air and then go down to their hands and extend their legs out like they would for a regular burpee, and repeat this continuously. Now I'll have the patient perform a plank knee tuck. So the patient will once again get into a plank position, extend their legs out, and then tuck both of their knees at the same time to their chest, and do this repeatedly. Okay, so now for lower extremity exercises, the first exercise I will have the patient perform is going to be Slideboard sprints. So the patient is going to put their foot up against the side of the Slideboard, and they're going to push off the Slideboard and sprint laterally on the Slideboard. And they're going to do that both directions. The next lower extremity exercise I will have the patient perform is going to be the glute bridge curl on the Slideboard. So the patient is going to hold on to the side, and they're going to do a bridge with their hips, and they're going to slide their feet underneath their butt and then extend them back out. That's going to be the glute bridge curl. The next lower extremity exercise on the Slideboard I will have my patient perform is going to be the side lunge alternating sides. So the patient is going to get into a lunge position, and they're going to lunge to the one side, meet back in the middle, and then lunge to the other side, and they're going to repeat that. The last lower extremity exercise I will have the patient perform is going to be a low lunge. So the patient is going to get in a position where their knees are bended, and they're going to reverse lunge their legs behind them. And they're going to alternate legs. That's going to be the low level lunge.